Seniors, I want to ask you something very direct before we begin. How much water are you drinking every day? Because if your answer is anywhere between 6 and 8 glasses, and you are still experiencing fatigue, brain fog, joint pain, cold hands and feet, or high blood pressure, then I need to tell you something that will completely change how you think about hydration for the rest of your life. Plain water, on its own, after the age of 60, is not enough. And in some cases, drinking more plain water without this one critical mineral is actually making your symptoms worse. Not better, worse. Today, I am going to tell you exactly which mineral your water is missing, why your body after 60 desperately needs it, and the precise way to add it that produces results most seniors feel within 72 hours. Why plain water fails after 60. Here is something your doctor almost certainly has never explained to you during a routine appointment. After 60, your body's ability to retain and use water changes dramatically at the cellular level. Your kidneys become less efficient at regulating electrolyte balance. Your cell membranes, the walls that control what enters and exits each cell, become less permeable. This means water you drink passes through your system without fully entering your cells, where it is actually needed. The result is a condition researchers call cellular dehydration, where you are drinking plenty of fluids, but your cells remain chronically thirsty. And cellular dehydration after 60 produces a very specific set of symptoms that most seniors and most doctors incorrectly attribute to aging. Persistent fatigue that sleep does not fix, joint stiffness that is worse in the morning, brain fog and slow thinking, cold hands and feet, elevated blood pressure that does not fully respond to medication. Every single one of these can be a symptom of cellular dehydration, not aging. The missing mineral. The mineral your water is missing is magnesium. And before you think you have heard this before, stay with me because the connection between magnesium and hydration is something almost nobody talks about, and it is the most important piece of this puzzle. Here is what magnesium actually does inside your body that relates directly to hydration. Magnesium activates a protein called aquaporins. Aquaporins are essentially water channel proteins, tiny doors built into the walls of your cells that allow water to pass through and actually enter the cell. Without adequate magnesium, these aquaporin channels do not function properly. Water sits in your bloodstream and your digestive system, but it cannot get into your cells where it belongs. A landmark study from the Journal of the American College of Nutrition found that magnesium supplementation increased cellular hydration markers by 31% in adults over 60, without changing the amount of water they drank. Same water intake, 31% better cellular hydration, simply by adding magnesium. And here is the second critical fact. Over 70% of seniors are magnesium deficient, not slightly low, clinically deficient, because magnesium is stripped from most processed foods, because common medications, including blood pressure medications, antacids, and diuretics, all deplete magnesium, and because as we age, our intestinal absorption of magnesium naturally decreases by up to 30%. The exact method. Here is precisely how to add magnesium to your water for maximum absorption and fastest results. The form matters enormously. There are many types of magnesium, and most of them absorb poorly. Magnesium glycinate is the form with the highest bioavailability, meaning your body absorbs and uses the most of it. It's gentle on the stomach, crosses the blood-brain barrier directly, and has the strongest research support for the symptoms seniors experience most. Magnesium chloride in liquid form is the second best option, specifically for water addition. It dissolves completely and absorbs rapidly through the digestive tract. Standard magnesium oxide, the cheapest and most common form found in drugstores, has only 4% bioavailability. It is essentially useless for cellular hydration purposes. The preparation is simple. Add 300 milligrams of magnesium glycinate or 5 drops of liquid magnesium chloride to 16 ounces of room temperature water, not cold. Cold water slows gastric emptying and reduces mineral absorption. Room temperature or slightly warm water allows the magnesium to reach your small intestine faster, where absorption actually occurs. Add a small pinch of Himalayan pink salt. This is not optional. Sodium works synergistically with magnesium to activate the aquaporin channels we discussed. Without this sodium signal, magnesium absorption is reduced by up to 40%. Squeeze a quarter of a fresh lemon into the mixture. The citric acid from lemon forms magnesium citrate naturally in the glass, a highly bioavailable compound, and the vitamin C improves mineral absorption at the intestinal wall. Stir well for 20 seconds. Drink slowly over 10 minutes, not all at once. When to drink it? Timing is everything with this protocol. First glass, morning, 20 minutes before breakfast. Your stomach is empty, absorption is highest, and this glass sets your cellular hydration baseline for the entire day. Second glass, afternoon, around 2 to 3 p.m. This is when cellular dehydration symptoms peak in seniors, the mid-afternoon fatigue, brain fog, and joint stiffness most seniors experience every day. Third glass, 30 minutes before bed. Magnesium taken at night activates GABA receptors in the brain, reducing cortisol, improving deep sleep quality, and allowing overnight cellular repair to happen properly. 3 glasses, that's the full protocol. What seniors report in 72 hours? Most seniors who follow this exact protocol consistently report the same sequence of improvements. Within 24 hours, reduced muscle cramps, especially overnight leg cramps that have been occurring for years. Within 48 hours, noticeable improvement in morning joint stiffness. The first 20 to 30 minutes of the day become significantly easier. Within 72 hours, measurable improvement in energy levels, especially the mid-afternoon fatigue that most seniors accept as normal, becomes dramatically reduced. After 2 weeks, blood pressure readings in many seniors drop by 8 to 12 points systolic without any medication changes. Cognitive clarity improves, skin hydration improves visibly, and most seniors report sleeping more deeply and waking less frequently during the night. One important caution. If you are currently taking any medications, particularly diuretics, blood pressure medications, or diabetes medications, please speak to your doctor before significantly increasing your magnesium intake. Magnesium has a blood pressure lowering effect. If your medication is already managing your blood pressure and you add therapeutic magnesium, your pressure could drop lower than intended. Start with 1 glass per day for the first 3 days. Monitor how you feel. Then add the second glass in week 2 and the third in week 3. This gradual approach is safer and actually produces better long-term results because your cells adapt progressively rather than being flooded all at once. Your body is not aging faster than it should. It is thirsty in a way that plain water alone cannot fix. And now you know exactly what to do about it. If this video helped you, please subscribe and hit the bell because next week I am revealing the 5 morning habits that add 10 years to senior life according to the latest longevity research. I'm Dr. Mark. Drink smarter, live longer. I'll see you in the next video.